Hello, my name is Janine D'Anniballe, and I'm the Director of Trauma Services and Moving to End Sexual Assault at Mental Health Partners in Lafayette, Colorado. I'm a licensed psychologist, and I have been working in the field of psychological trauma for over 25 years. Today, I'd like to address specifically those of us who are on the front lines of this crisis, working as medical providers in our hospitals, emergency rooms, and clinics. Nurses, doctors, EMTs, or anyone who might be interfacing directly with people presenting with health concerns in this midst of this pandemic. This event is anxiety producing for all of us, but perhaps you all feel this anxiety, the stress, and the pressure of this moment most acutely. You have to go to work. You have to walk right into the front lines to be in contact with people affected by the coronavirus, while most of the rest of us are social distancing. Perhaps you're even quarantined right now so that you can eventually go to work, and therefore you can't as easily take care of needs for your family or your home or your pets as the rest of us are afforded the luxury of doing right now. This threat to you is quite unique, not only in the fact that you could become sick yourself, but fear that you could also infect your children, your elderly relatives, and the threat of knowing it's possible that you might have to make some of the most traumatic decisions possible, deciding who might live and who might die in the face of not having adequate equipment for the job. This is what's known as pre-traumatic stress. That stress can manifest in all kinds of ways. Anxiety, overwhelming emotions that might change from moment to moment, feeling frozen, feeling anger, even rageful at times, and even a desire to quit and just flee from the situation entirely. This is a normal response to quite abnormal events. The impact of this cumulative stress builds and rises in the nervous system. Under a high degree of threat, stress hormones start circulating through the brain and through the body, preparing us to act, preparing us to respond. The only problem is, at least right now, in some communities, there are nothing for first medical responders to do except wait and think and worry. So this brings to light even more the importance of discharging those stress chemicals from the body as we wait. So discharging by way of moving them through, walking, running, shaking, anything to actually create some type of release in the body. Any kind of prolonged stress like this without that discharge can serve to dull the sharpness of our prefrontal cortex and allow the amygdala, which is known as the fear center of the brain, to take over and leave us more in a mode of reacting rather than thinking and responding. So, how to set the nervous system amidst these extremely challenging circumstances? First, we come back to just basic grounding skills. So wherever you are now listening or watching to this, I just invite you to take a moment to feel your feet on the floor. So if you're standing, just feeling your body kind of root down into your feet, and if you're seated, just feel the feet make contact to the earth. Feel the backs of your legs against the chair, and just feel this energy of being rooted down, right? Connected to the earth, connected to something greater than you at the moment, something holding you and keeping you tethered here to this moment right now. And then as you sit in this grounded space, we work on finding deep belly breathing, When we're stressed or anxious, it's very common for us to breathe from our upper chest, right? That doesn't allow us to fully kick in the relaxation or the parasympathetic system in the body. So we invite that in by the deep belly breath. So as you inhale, you feel the low belly begin to expand up and out as you draw breath up to the chest all the way to the collarbones. And then as you exhale out the nose, you reverse that flow from collarbones to chest to low belly. Feel more of just that slow, even breathing. And another visual cue that could be helpful is with this breath ball. We imagine as we inhale breath, we feel our lungs expand both up and out, drawing breath all the way up to the corners of our lungs. And then as we exhale out the nose, we push air out, 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 and one last breath out to really activate the relaxation response. So working on that, practicing that, know that if you're practicing this grounding and this breathing work now, it can be more accessible to you in the moments when you really need them, in the moments of crisis. Another thing that can serve to reset the nervous system is a simple mindfulness exercise. And what mindfulness is simply is paying attention to one thing at a time on purpose without judgment. So whether that is just looking at a picture or a piece of art and just noticing the colors or the shapes of it, just doing nothing but observing it, describing it in your mind. This is a good exercise to do if you're surrounded by a dog or a cat or another animal, to just mindfully notice the color of the fur or the way the animal breathes or what you might notice on its whiskers. Or even just looking out the window to see any wild bird in flight or sitting on a tree and its movements, and just being with that image wholly and completely for just 1 minute. This can serve to give our brain something else to do than to observe its chatter. It can be calming, grounding, and ultimately lower our anxiety. Another piece that will be critical for you first responders as you move forward is to tap into the supports that exist on your team, among your colleagues, amongst your friends who are side by side with you walking into this crisis. You're in this together. You're about to face and work together in one of the most challenging experiences this country has ever had. Build each other up. Complement each other. Be there for each other, even if that support is a simple nod, a smile, or just sharing a quick laugh or cry when you have a moment. It's essential to connect with when possible and fuel and draw on each other for that support and inspiration, even if it's unspoken. Perhaps most importantly at this time, for all of us, but you in particular, is to minimize your exposure to media and social media. Trying not to read or listen to or watch anything that isn't essential to you being able to do your job. This pelting of information, most of which are things we can't control or do anything about, can only serve to ramp up our nervous system. It can leave us feeling helpless, hopeless, and even more paralyzed with fear. So minimizing that by maybe using one or two trusted sources of information that you check periodically when you're in the place to be able to absorb it. Do not let the media be a backdrop, a soundtrack to your day, right? But instead, you be in control of when and how you consume it. And then finally, as you move forward in your work, on your shifts, ending your shifts by shaking the stress out of your body, literally moving it through. So resisting the urge to leave work, to go home, to sit, to read, to watch, and instead process that emotion through your body, through movement. Even if it's some gentle yoga poses of just lifting the arms up and down, or shaking, or dancing, or walking the dog around the block. That will serve your nervous system much better in the long run. And then finally, take a minute to remember and visualize your strength, your competence. Maybe remember a time when you responded effectively to a crisis. Take a minute to remember that. What you did, how you communicated, how did you use the resources around you, the effective ways you made decisions. Breathe that into your body. Remember it. Trust it. You know how to do crisis. Perhaps we haven't seen anything of this scale, but the tools are the same. Moment by moment grounding, resetting the nervous system, trusting yourself, and coming together as a team, knowing your community is fully behind you. You got this. Thank you.